Hi everybody, Dr. Bupp here at Advanced Health Wellness Center.
And Leah, hi, how are you?
With the expert, Leah Klein. And so we're really excited. We've spent some time while we kind of had a little bit of downtime looking for ways to not reinvent but improve and renew our joint rejuvenation program. And we've actually come up with some ways to be able to use your insurance, use people's insurance to help them make regenerative medicine or this joint rejuvenation program a bit more affordable. And so we're really excited about that. We're able to do more and offer more. And we really like the fact that it has a couple of phases now. And some of those phases are significantly benefit from insurance coverage. So that is also nice because it gives people a chance to lower their cost, and also it gives people access to care that maybe didn't have it when it was only cash and it was just, if you've seen others talk about stem cells or whatever, those kind of things. So this is not that. This is a hybrid program. And the first part that we're going to talk to you today about is the first phase is reducing inflammation, and there's some products that we use to do that. But we want to reduce inflammation and get better joint motion, and there's ways that we go about doing that. And so Leah is here to explain that process to us.
Sure. So, first we always start with our consultation and our examination, our x-ray to see you still have to qualify for this phase even. But this phase we can use some insurance coverage for. We actually have discovered that if we can get some inflammation down and the joint moving a little bit better, we have less issues later on with like the soft tissue aspect of things, instead of going straight with the regenerative protocols. So like for example, sometimes going straight to the umbilical tissue can be painful if your knee's very inflamed still, and then we have some issues with starting from ground zero when we're trying to get muscles and tendons and ligaments moving and things like that. So hyaluronic acid comes in very 5 different brand names depending on your specific insurance plan and that kind of thing. But hyaluronic acid is
What are some of those?
Suparts or Synvisc you may have heard of. There's Euflexa, there's Genvisc. So there's a whole handful of things that typically the insurances kind of have a preference for.
The insurances kind of dictate which ones we are supposed to use or which ones we need to use. There's specific, you have to meet some specific requirements in order for that to be approved for you to do. But if you meet those requirements, it's really covered by basically almost every insurance company that we know of, including Medicare. Again, you have to meet the medical necessity requirements in order for it to be appropriate to do with you. But people that have had knee pain or joint pain for years, a lot of times will fall into that. There's other types of injections and things that also can be done though. As say we're talking about a shoulder, or we're talking about some other joint that is painful. There's still some coverage, and it's different types of treatments.
Yeah. So anti-inflammatory injections, we still, we don't use cortisone in this office still. We will always preach that cortisone has negative, effects on the joint and the tendons surrounding it, as well as systemically. So that's not something that we offer, but we do other types of anti-inflammatory injections. So for example, the shoulder or the hip, wrist, any other kind of those joints other than the knees will benefit from an anti-inflammatory injection.
So the goal is to reduce inflammation and improve motion, pain-free motion, even before we start the other stuff. Cool. And so far we've seen that it's, number one, has improved the cost effectiveness of treatment. We've been able to do more services with patients, and we think that the results have been better as well. So that's it for part 1. We're going to be doing a webinar August, what is it?
11th.
August 11th at 6:30. So it'll be a webinar describing the 3 phases of care, and who qualifies for what and who doesn't, and some more detail. But we're also going to do a part 2 video next week that's going to talk about phase two of the joint rejuvenation program. that we're, like I said, we're really excited about.
Yeah.
Anything else?
I don't think so.
Cool. So tune in if you have any questions, or if you'd like to talk to Leah. She's actually opened up some times in her schedule to do consultations. They're free, to answer questions, to find out if people are good candidates, whether they should be evaluated and examined or not. And so she is available to do that too. So again, if you're just up in the air, you got pain, you've not been sure what to do with it, again, this might be something. Just talking and having evaluation would be a good start. So that's it. Hope you have a great day, and we'll talk to you soon.
Bye, guys.